Hey everybody, our group's presentation is going to be on the COVID-19 vaccine. My name is Lindsey Popelka, and I'll be talking about some of the basics of COVID-19 and how vaccines work. In order to discuss a COVID-19 vaccine, it is important to understand what COVID-19 is first. COVID-19 is a new coronavirus caused by SARS-CoV-2, which is Severe Acute Respiratory Syndrome Coronavirus 2. The most common symptoms are cough, fever, and shortness of breath. COVID-19 is spread through infected respiratory droplets, which can be expelled during close face-to-face contact by coughing, sneezing, or talking. In addition to this, infected respiratory droplets can remain on a surface and can be spread to an individual if they touch their mouth, nose, or eyes after touching the infected surface. COVID-19 was very recently discovered in 2019. This means that there is still a lot to learn about it as it's such a new virus. Currently, there is no specific treatment for COVID-19 infected patients. Because there isn't a specific treatment plan for these patients, it is so important to develop a vaccine to prevent these infections. So how do vaccines work? The goal of a vaccine is to essentially trick the body into making antibodies for a disease without actually having that disease. Most vaccines contain weak or dead disease germs. When these weak or dead disease germs enter the body views them as invaders, and the immune system produces antibodies to fight these invaders. These antibodies then build up within the body. If a vaccinated individual then encounters stronger disease germs and the germs enter the body, the antibodies can destroy them and prevent the individual from getting sick. Often the antibodies stay in the individual's body forever, which gives the vaccinated individual permanent immunity.
Hi, my name is Polski. I'm going to talk a little bit more in depth about the COVID-19 vaccine that just circulated. Well, it's beginning to circulate, and we're going to focus a little bit on a company called Pfizer. So they're a research-based global biopharmaceutical company. They're actually local in some cases. My mom worked for Pfizer in Ann Arbor, Michigan. So currently, Pfizer partnered with BioNTech from Germany. They partnered together to try and tackle this COVID-19 vaccine. In the first study that Pfizer produced, it was a blinded study that showed the vaccine to be over 90% effective in the first trial. So it may not sound like a lot, but if you compare that with an influenza vaccine that are typically only 40 to 60% effective at best, 90% is very exciting and it's very hopeful. So Pfizer is expected to receive federal permission to release the vaccine by the end of November. In regard to the side effects that were seen with the blinded study, it was fever and fatigue, nothing too serious. So how Pfizer plans to distribute the vaccine. By the end of the year, we could have 30 to 40 million doses just from Pfizer alone. So when you multiply that also by the 9 other candidates that are also in the final stage of testing their vaccine for COVID-19, it looks very promising that 2021 might be a normal year and hopefully we can end this pandemic together. So those general public members who are high risk will have the first chance at the vaccine. This is most likely going to be healthcare workers, doctors, nurses, nursing homes, staff, and of course the elderly. Us college students probably won't have first bid at the vaccine. So going back to the numbers of the vaccine, 30 to 40 million doses is enough for 15 to 20 million people to receive the vaccine and then receive a booster 3 weeks later. I received all this information from the New York Times.
Hi, so my name is Isabela Paixo, and I'm going to be talking about some of the other specifics that have to do with the COVID-19 vaccination. So first off, we have potential side effects. So as of now, the vaccine will most likely require 2 doses given weeks apart to be fully effective. But on the downside, there are side effects that may disrupt daily life, which may cause you to miss a few days of school or work. And a quote that I had found from a scientist says that there's evidence that suggests if you frame pain as a proxy of effectiveness, it's helpful. If it's hurting a little, it's working. So maybe this may be true, but a lot of people aren't going to want to deal with the negative side effects that this vaccination may cause. And scientists do believe that the vaccine will cause flu-like side effects that may last for days, which will include sore arms, muscle aches, and fever. So importance of communication is one of the biggest things that scientists are talking about at the moment. So, first off, being open and communicating effectively will help people plan for the effects that the vaccine may cause, especially because many people don't have sick leave or health insurance, so it's really hard for people to be able to get time off. So, scientists are saying and suggesting that essential workers be granted 3 days of sick leave following their vaccination, just in case they were to experience any of these flu like symptoms that would disrupt their life. And it's crucial to make consumers aware that 2 doses will likely be necessary and it could take about a month for full effectiveness. And if you aren't getting the dose within the time span, you would have to restart the vaccination process just because it wouldn't have the same effectiveness if it was done correctly. With that being said, it's also essential that consumers follow through with their shots from the same maker and not a vaccination from, say, a different company. And another quote that I had found is, if we just show them the tunnel, not the light, then that results in this or mass denial. And that's basically just saying that people need to realize that even though there are negative side effects to it, in the long run, that getting the vaccination will definitely be worth it. So 100% communication cannot occur until the final trials of the Pfizer vaccine are in place. With that being said, even though there is going to be a vaccine in the near future, it is still crucial to continue wearing masks, washing your hands, and social distancing, just because this is not going to be 100% effective, just like any other vaccination. So there are still many people that have opposition against the vaccine. So the main arguments for this are that the vaccine may not be safe enough. People are concerned about the possible side effects, that COVID-19 may not be that dangerous for their health, anti-vaccination, and that it's best to let nature take its course. So some people are believing that the research is going far too quickly and that these risks could be downplayed just because the vaccination for COVID-19 has been a little bit rushed. And so the main argument for most people is that the vaccine may not be safe enough. So I found that 46% of people who had gotten this vaccination showed a temporary decrease in white blood cells, which led to a weakened immune system. And in one case, there was a woman who developed an autoimmune disease called transverse myelitis, which is an inflammation of the spinal cord that ended up being linked to the vaccine. So obviously it's not very common just because it happened in one case, but there are people that know about this, so we're definitely really worried of the side effects that may come from the vaccine. So like I mentioned earlier, that many people are concerned about the side effects, that COVID-19 is not that dangerous for their health, anti-vaccination beliefs, and they believe that they should.
My name is Emily Barnhart, and I'm going to talk a little bit about the priority candidates of the vaccine and also why you should get the vaccine. So first, there are 4 groups of priority candidates. That includes healthcare personnel, essential workers, those with underlying health conditions, and adults older than 65 years. Healthcare personnel includes hospital workers, nursing home, pharmacies, outpatient care, home patient care, and EMS. Essential workers include the non-healthcare workers such as food workers, transportation, education, energy, law enforcement. People with underlying health conditions can have a variety of different conditions, but some examples include cancer, COPD, obesity, diabetes, heart conditions, and chronic kidney disease. All 4 of these groups are susceptible to COVID, which is why they are given priority on the vaccine to help combat the infection. Next, just a few reasons why you should get the vaccine. Getting a COVID vaccine could help make the effects of the illness much less severe if you do contract it. Basically, a vaccine works with your immune system to fight off the virus if you're exposed. There are some side effects to the vaccine, but none would have effects nearly as great as contracting the actual virus itself. Getting the vaccine could protect people around you, especially those who are at high risk, including those with underlying health conditions and, of course, the elderly. As I mentioned earlier, the vaccine works with your immune system to fight off the virus. It does so by creating an antibody response to COVID-19 without having to experience the actual illness. For the vaccine to be approved, the benefits must outweigh the potential risk, which is why vaccines are considered safe and you shouldn't be worried about getting the vaccine. To sum up the vaccine in total, though, as of right now, there's no treatment for COVID-19, which just stresses the importance of vaccine development to help combat the virus and make it less severe. For the vaccine to be approved, it must be rendered more beneficial than harmful. So essentially, the effectiveness of immunity must outweigh the potential side effects. As I stated earlier, healthcare personnel, elderly, essential workers, and those with pre-existing health conditions are most likely to receive the first vaccinations.